We tend to think about the military as this monolithic organization that never changes, but in fact, there's a large turnover of people, and people are constantly coming and going, and many of those who served in the wars over the past 14 years have left the military and moved on in their life. They're getting their treatment in VA hospitals, they're getting treatment in civilian hospitals around the country where clinicians may or may not first recognize the fact that they've had these experiences, and secondly, if they do recognize it, not quite know how to deal with it. I think for families, what they're counting on is some understanding and some access to services that are culturally sensitive to the needs of military families and the experiences of combat veterans. So we want to ensure that for those in the community, and it's hard to predict where service members or veterans are going to pop up to get their care, that all healthcare providers are prepared to ask questions about combat exposure, to be thinking about and screening for or asking about prior diagnosis of PTSD or TBI and the impact that that's been having on the family. So even for providers who don't have experience in the treatment of PTSD or TBI, who might be contacted by someone seeking treatment, they can be of great help and assistance. First, what they can do is validate the desire for the treatment. Many vets are reluctant to seek out help, and so if they in fact choose to do so, we really want to encourage them to continue that and to assist them in any way we can. So helping them identify a provider in the community, whether that be through a VA or through a colleague that that provides that kind of treatment, can be extremely important. And so I think one of the goals that we would have is, if you're not a clinician that feels ready to treat vets and service members, know who is and be prepared to refer to them.